It is a pleasure and a privilege to have with us today Dr. Mitwa Ghosh. Dr. Mitwa Ghosh heads the molecular biology and the genomics labs at HCG. Welcome, Dr. Mitwa. Thank you. So the buzzword these days we hear everywhere the words genes and genomics. Doctor, what exactly is genomics? So, technically speaking, genomics is a study of the whole genome of an organism. Okay, when I say whole genome, it means the study of the entire gene profile of the organism or the individual. But if I really make it simple, what are genes? You know, your genes are the storehouse of information. So all about your characters, whether you look like your father or you look like your mother, what will be your hair color, what will be your eye color, are all influenced by genes, right? And the study of all this genomic profile or the genomic makeup is actually genomics. Wonderful. Thank you, doctor. So, how does genomics play into cancer? I mean, what is it that we study when we say genomics in cancer or precision medicine in cancer? What do you mean? So, as I said, genes are something which determine your favorable traits, right? That is, how is your hair color or eye color. But at the same time, any abnormality in the genomic makeup will also, result into an abnormality, which might be a disease. And cancer is such a very common human genetic disease, right? And in cancer, what happens? Your normal cells are converted into malignant cells because of genomic abnormality. There could be a lot of genetic alterations in cancer. There could be higher expression of certain genes or under expression of certain genes. The most common alterations in cancer are called mutations. That is, there is some errors in your DNA makeup or the genomic makeup. Now, when I talk about mutations, these mutations could be of two types. Okay, there could be somatic mutations. Somatic mutations are sporadic mutations. These somatic mutation or sporadic mutations are acquired by an individual over a lifetime due to several factors. It could be environmental factor, it could be lifestyle, it could be many other habits like tobacco, alcohol, or this mutation could be hereditary, which comes from the family. Now, even when I talk about somatic mutations, there could be number of mutations. There could be number of somatic mutations. So the question is, are they all important? No. There are certain driver genes and there are certain passenger genes. Now, driver genes are genes which drive the disease, right? Passenger genes which are quiescent today, which don't drive the disease, but you never know, they can be driver tomorrow. So it's very important to understand what is driving the disease. And if something is driving the disease, whether that can be targeted, that can do we have any action against those driver mutations? By driver mutations, you mean if we can have drugs for them? Yes. So basically, when I talk about actionable mutations, these actionable mutations are those for which FDA approved targeted therapy is available. Okay, and this FDA approved targeted therapy are for those cancers which the doctor is treating or for some other cancers. So, for example, the doctor is treating a breast cancer. This patient has a mutation. That mutation is not very prevalent in breast cancer, but it is prevalent in colon cancer for which there is a drug, right? So, is there any opportunity that you can repurpose that drug for breast cancer? Can you use the same drug in breast cancer? So, FDA approved therapy for the indicated cancer and other cancers, or there are some clinical trials available. Okay, so traditionally, what happened is our treatment was more of a protocol based, right? But now, in the current scenario, treatment is more personalized, individualized, where the doctors have to know the biology of the cancer. Doctor has to know the genetic and the molecular profile of the cancer, and based on the genetic and molecular profile of the cancer, they can manage the patients better, and they can think about the new innovative or the FDA approved drugs which are available for treating the patient. So that is why it is called precision medicine, because one particular gene requires a particular kind of treatment. Correct. And not everybody has the same genetic makeup. Yes. So, doctor, are these therapies or these tests rather, these genomic tests, are they very expensive? Can patients afford them? See, cost is a very relative term, and you have to compare with multiple other things. First, we have to understand why we are doing the test, right? And I have very specific points why we these tests have to be done. Number one is early diagnosis of cancer. Can we diagnose early? Can we diagnose in the early stage? So that because now we know if we diagnose early, it's useful or it is helpful to manage the cancer patients better, right? And early diagnosis is cure. We need to understand the biology or the molecular or the genetic makeup of the cancer. So we want to do the test. And the third thing is to, after we have understood the biology or the molecular makeup of the cancer, what is the right thing to be done? So, what is the right drug? What is the right time to give the drug? And at what right doses the drugs can be given? So, if we understand what we need and why we are doing the tests, it becomes very, very helpful and cost becomes negligible at that time. So, we have to understand that treating patients as per protocol, we have seen about 40 to 45% of cases don't respond to that therapy. Correct. Because now we know cancer is a heterogeneous complex disease, right? And no two patients are same, no two tumors are same. Even one patient has two tumors, these two tumors will be different, right? So cancers cannot respond to the same protocol based therapy, right? And so that's the utility of genetic testing. And there is a cost involved in the cancer treatment. But if you do the right treatment at the first time, correct, you can save a lot of money and time if you have the complete profile, genetic profile of the patient in front of you.
Right. So, doing the right treatment at the right time saves you unnecessary treatment and therefore actually eventually saves you money.
Yes.
Great. So, doctor, you spoke about diagnosis. Can genomics also be used to prevent disease?
Yes. So, as I told you that cancer, the mutations or the cancer alterations could be sporadic, it could be familial also, right? So 5 to 10% of cancer, actually 5 to 10% of breast cancer is inherited. And when you talk about ovarian cancer or endometrial cancer, about 15 to 20% of those cancers are inherited, which is passed on from the family to the family. Okay. So it's very important to understand that whether the cancer is inherited or not, whether cancer is coming from the family members. In addition to this, cancer can be also familial. Okay, so although there is no faulty gene which is being transmitted or passed on, there could be a shared environment or shared lifestyle in the family which might cause cancer. So it's very important to understand this disease. Now, when I say breast and ovarian, I must admit that it's not only women who have the inherited cancer. Even men can have inherited cancer. Men can have breast cancer, which can be inherited. Prostate, pancreas, colon. These are certain cancers which there could be a inheritable component, which is about 5 to 10%, and it's very important to understand that.
So there are tests for that.
Yeah, there are tests for that. Yes. Yes.
So, in your experience, doctor, can you share some stories about how genomics has actually helped patients?
Yes, I mean there are multiple times. I would first like to say that in our lab we have done almost about 3,000 patients where we have tested both for sporadic somatic mutations, and we have seen that about 40 to 45% of cases there were mutations which had clinical utility, where you could have changed a drug or you got the information about the prognosis. Okay, in certain cases there were no mutations, but in certain cancers even no mutations is a good result, because in those cases some drugs would work better which would not have worked if there were mutations. Okay. Right, so in that way. So, as an example, you know that hormonal positive or HER2 positive, HER2 new positive breast cancers, we all know they work best with Herceptin, right? But in many cases, we have seen there could be resistance to Herceptin, or patients treated with Herceptin don't respond after some time. So, repeatedly, we have tested all these patients and we have seen there is a prevalence of certain genes which could be responsible for this resistance. So the question is, should we still go ahead and treat these patients with Herceptin, or we combine Herceptin with certain other drugs based on their genetic or molecular profile to have a better efficacy and treatment protocol? In certain cancers, we have seen there are certain genes which might not have an actionable drug, but it tells us that the cancer is highly aggressive, or it tells us that cancer might not have a good clinical outcome if treated with the standard of care like radiotherapy or cisplatin based chemotherapy, and is very common in head and neck cancers, right? So now if we know those mutations are there, should we still go ahead with the standard of care, or should we just tweak the protocol or do something else, give them biological therapy or give them immunotherapy? So these are the, I mean, I have several examples, but to make the long story short, yes, it helps a lot. It helps a lot to understand the treatment protocol, helps a lot to understand the prognosis and the biology of the cancer.
Wonderful. So thank you, Dr. Mitwa. This was most insightful. So as you can see that genomics and genomic tests or genetic tests can actually predict what kind of therapy the doctor will be using for you, and therefore you will basically have the right treatment at the right time, and you will be saving a lot of money, and of course most importantly you will be treated right. So do consider and spread the word, and if you have any questions, reach out to us in the comment section. Thank you.